really grateful and honoured to have received this Sachs Institute Research Action Award, but more importantly I'm thrilled that it will hopefully shine a spotlight on the needs of young people. And what we know is that their ability to understand and access healthcare is limited by a number of reasons, and so it's really important that we see access to healthcare for this age group as a major determinant of their future health and well-being. The research I've been involved in is around access to and navigation around the health system for young people in New South Wales, but it has broader national application within our Australian health system. We initially studied the barriers that young people experienced when trying to access healthcare, and we followed that up very quickly with a study that looked at programmatic and service level responses to those barriers and developed a framework for providing youth-friendly healthcare. The more recent study was again a sort of longer-term follow-up from that, which re-looked at barriers again in a digital age, because massive changes had happened at society level with young people having regular and frequent access to digital technology. The early work on access identified that confidentiality was the most important barrier for young people, and that was really consistent with international literature. What we found more recently was that confidentiality, in fact, was no longer a major barrier. Cost had become the most important reason why young people couldn't access healthcare or couldn't follow up on healthcare. The Access 3 study was directly translated into policy, and that was part of the research design where we actually included a policy translation forum. When I counted the number of individuals who supported all of these access studies, and I'm talking about governance, research team, reference groups, there were actually well over 100 individuals who contributed to these 3 research studies. So in addition to them, there are something like over 2,000 actual study participants, from young people through to managers and service providers and policy makers.